Minister Elliott, Minister Smith, MPP Cramp, Warden Rick Phillips, Mayor Joanne Albert, Mayor Harrison, Mayor Panchuk, guests and friends, welcome. My name is Pat Daub, and it is my pleasure to welcome you to today's announcement here at Gateway Community Health Center in Tweed. I am the Executive Director for Community Care for Central Hastings, and we are one of over 20 agencies who together make up the Hastings Prince Edward, Ontario Health Team. To open today's proceedings, I would like to acknowledge that we gather and work on traditional lands of the Algonquin, the Haudenosaunee, and the Anishinaabe. This land is rich with the wisdom and traditions of these people. It is heavy with the impacts of colonization. In recognizing Indigenous peoples' relation to this land, we are recognizing we are settlers, and we are each called upon to reconcile our shared past and build a new shared future, act by act, among all people who share this land. Thank you. Today we will be hearing from Minister Elliott, Minister Smith, and MPP Cramp, as well as people from several organizations representing the diverse geography, expertise, and roles that make up the Hastings and Prince Edward, Ontario Health Team. Health service providers, municipalities, community organizations, and the people that we all serve, our patients, clients, caregivers, our community members, are coming together here today, and as Ontario Health Teams is about all of us working better together to address the healthcare and health impacting issues facing our communities. Now it is my pleasure to welcome Minister Christine Elliott to the podium.
Well, thank you very much, Pat, and for your kind introduction, and good afternoon, everyone. Before we begin, I would like to extend my deepest condolences to the family and friends of the child in Waterloo Region who passed away due to COVID-19. This is a truly tragic situation, and not only is it a heartbreaking loss for the community, it's also a devastating reminder of the serious consequences of COVID. My thoughts and prayers are with all of the friends and family at this time. So it is great to be here, though, in Hastings County with my good friend and colleague, Minister Todd Smith. Unfortunately, MPP Cramp was not able to join us today, but he's certainly with us in spirit, and he sends his best wishes and congratulations. I would also like to thank the team at Gateway Community Health Center for hosting us, and I hope I'll be able to have a tour before I leave. I would also like to thank the many healthcare workers at Gateway and in the community for their continued dedication to providing exceptional care for patients throughout the COVID-19 epidemic. Long before any of us had ever heard of COVID-19, remember those days? I can just barely myself. But our government did make a commitment to end hallway healthcare and build a better, connected healthcare system that is based on the needs of patients and families. From this goal formed the vision for Ontario Health Teams, which bring together healthcare providers to work as one team. This new model of care breaks down long-standing barriers and allows providers to deliver better, faster, more coordinated, and truly patient-centered care. The COVID-19 pandemic has just highlighted the importance of this work. Throughout the pandemic, the province's 42 Ontario health teams have set up assessment centers, launched virtual care initiatives, and rolled out vaccines, often bringing them directly to people's homes. The Ontario Health Team model has proven how a collaborative team can help each other in times of need while still keeping the patient at the center of care. That is why I am very pleased today to announce 8 new Ontario Health Teams. With these new teams, there are now 50 Ontario Health Teams that will provide better connected care to 92% of the province's population. Included in this is the new Hastings Prince Edward Ontario Health Team. With a rich history of working together, this team truly understands a collaborative, connected approach to patient care. In its first year, the Hastings Prince Edward Ontario Health Team will focus on enhancing care with people facing mental health and addictions challenges, as well as those requiring home and community supports. The team has also established a patient partnership action team to help guide them and ensure that they remain patient-focused. So congratulations to everyone who has made this possible, and let's join in and congratulate everyone for this. This is a wonderful, wonderful example of true patient-centered care here. So to support the new Ontario Health Teams, we will be providing $9 million, approximately $1.1 million for each new team, to help them begin the important work of connecting care for patients and, of course, to support their local COVID-19 response. Working with our healthcare partners, our government will continue to establish Ontario Health Teams across the province. We're almost there. Together, we are building a connected, patient-centered healthcare system that will meet the needs of Ontarians now and well into the future. And with that, I would now like to ask my good friend and colleague, Minister Todd Smith, who is no stranger to any of you, to please come forward and share a few remarks. Thank you.
Well, thanks, Christine. We just absolutely love having you in the Quinte region, be it in Prince Edward County, where we were earlier today, or here in Tweed, affectionately known as the other GTA. It is great to have you in the greater Tweed area for this announcement, and great to see so many of my municipal colleagues who are here as well, and friends. And this is an exciting day for healthcare in the Quinte region, for Hastings and Prince Edward counties, and we're all delighted to be here. As Minister Elliott alluded to, MPP Cramp unfortunately is unable to be here today. He's undergoing his own health battles right now and making good use of our healthcare system in Ontario. Happy to say that he's winning that battle. It's a fight, though, and he wishes that he could be here today to extend his congratulations to everybody on this effort that is so important for the delivery of healthcare in my old riding and his current riding up here in Hastings County. So thank you, Minister Elliott. It's always great to have you in the region and visit and share this kind of great news for 8 regions of the province receiving new Ontario Health Teams, including ours. One of the concerns that I do hear most often when talking to people is that they find it really challenging to navigate our healthcare system. Most people don't even know which organization does what, and they can't understand why it's so difficult to find the care that they need when they need it. Unfortunately, those silos do exist, and they make it pretty difficult, not only for our patients, but also for our diligent and hard-working healthcare workers who are doing their best to communicate and collaborate to deliver the best possible care outcomes for their patients. These Ontario Health Teams are designed to change that by pulling together everyone involved in care around a patient's individual needs. From family members and volunteers to those providing the most acute care in our QHC hospitals, and thanks Stacey Dobb for being here today, from birth to palliation, and from the South Shores of Prince Edward County on Lake Ontario right on through to the Highlands in North Hastings. It truly is an innovative model, and it's going to require a lot of teamwork and collaboration. So I'm really excited to see this primary care-driven team come together to raise the standard under the leadership of Sheila Bradick and Mayo Hako, and as Hall of Fame coach, NBA coach Phil Jackson would say when he was coaching those great Chicago Bulls teams of a couple of decades ago, the strength of the team is each individual member, and the strength of each individual member is the team. So I'll let you guys decide who's Michael Jordan, who's Pippen, who's Horace Grant, John Stockton, all those guys. Anyway, this approach really is going to improve patient care in our communities, and it's going to help in our ability to recruit and retain top talent, which is really important as well for our medical facilities and our community care agencies. And I believe this is a great day. It's a beautiful day here in the GTA, and I'm sure that my colleague Darryl Cramp, should he be here today, would have the same outlook and the same type of remarks as I've made here today, and our thoughts are with him, and I know his thoughts are with all of you here today and the job that lies ahead for our new Ontario Health team. So on behalf of Darryl and I, thanks for all of your hard work that you've done so far to get to this point and all of the work that lies ahead. And it is my pleasure now to introduce Dr. Rob Pincock from the Belleville Family Health Team. Doctor?
Thank you so much. Thank you, Minister Smith. I would like to start today by recognizing the contributions of my physician colleagues who couldn't be here today. It's with the hard work of Dr. Elizabeth Christie, Adam Stewart, Alex Ferreira, Carolyn Brown, Fraser Pollard, Chuck Mustard, Sarah LeBlanc, and Karen Clayton-Babb, and their commitment to improving health services in Hastings and Prince Edward that help make this shared vision a reality. And thank you to all of the doctors who helped get this project off the ground. We couldn't have done it without you, and thank you so much for attending all of these meetings. As a physician who works in primary care, in the hospital and in the emergency department, I see how important relationships with various stakeholders can be to supporting the health of those individuals receiving care in our communities. I also see firsthand what happens when people fall through the cracks. Primary care is all about fostering relationships over time. We have relationships with our patients, the specialists in our community, our hospitals, and the people who provide programs and services that maintain and support the health of the people in our communities. These relationships are important, but if we don't tend to them, they will weaken and suffer, communication will break down, and care for our patients will suffer. The development process for the Hastings Prince Edward Ontario Health Team has provided a mechanism to improve these relationships in the spirit of collaboration. The enthusiasm from the large collaborative of organizations throughout Hastings and Prince Edward has been overwhelming and incredibly encouraging. It's this enthusiasm that makes me optimistic that the Hastings Prince Edward Ontario Health Team will help make a difference to the people who receive care in Hastings and Prince Edward. That it can provide all of our stakeholders with the opportunity to truly co-design a system that coordinates care around patients and that can work well in each of our unique communities. We have a unique opportunity to use our collective skills, knowledge, lived experience, and resources to develop a robust network of health and community services that prevents individuals from falling through the cracks and meets the quadruple aim: improving patient care and caregiver experience, improving the health of the population, reducing the per capita costs of care, and improving the work life for providers. With the approval of the Hastings Prince Edward Ontario Health Team, we now have the resources to start implementing our shared vision and beginning this process of improvement. Thanks. I would like now to introduce Jane Wollenberg. I apologize. She is the patient-client representative with the Hastings Prince Edward Ontario Health Team.
Thank you, Rob. Good afternoon, Minister Elliott, and many, many special guests. It's a privilege to share in the excitement of today's announcement. I know that I'm echoing the thoughts and ideas and hopes of the Hastings Prince Edward Patient, Client, and Partner Council when I say we appreciate the level of respect and interest with which our ideas and suggestions have been received from the beginning of the application process until now. Listening and responding to the voice of the patient and providing health care and social services that are more connected and accessible throughout the community will ensure that the voices of patients, families, and caregivers will be heard and remain at the center of care. We believe that our lived experience provides a unique and valuable perspective in the co-design process, and we look forward to continuing our work collaboratively and respectfully to ensure that the shared work of providing improved and high-quality health care to everyone in our community remains at the core of the Hastings Prince Edward Ontario Health Team. Thank you very much. I'd now like to introduce you to Rick Phillips, who is the warden of Hastings County. Thank you.
Good afternoon, Minister Elliott, Minister Smith, and our best regards to our MPP, Darrell Cramp, who could not be here today, but we are all thinking of him. Mayor Albert from the municipality of Tweed, Mayor Panchak from the city of Belleville, and guests. First, let me welcome all of you here today and thank you for the decision to hold today's announcement here in the municipality of Tweed. Tweed is one of the 14 member municipalities that makes up Hastings County, and I'm proud to serve them as their warden. Today's announcement of the creation of the Hastings Prince Edward Ontario Health Team is an incredibly important milestone for all of the residents in our counties and both counties, Prince Edward and Hastings. It represents, I believe, a major step forward in ensuring a coordinated, efficient way to provide health care to our citizens and their larger patient community. Getting here has been possible only by the dedication of more than 40 groups and organizations that make up the health team here. So let me say, as others have, thank you for your hard work so far and for the many hours yet to come as our OHT gets up and running. I want to congratulate you for including both Hastings and Prince Edward counties in the OHT itself and recognize the important part that paramedic, long-term care, and other social services play in the everyday lives of our people. Healthcare is truly a continuum. Finally, let me offer my personal thanks to Minister Elliott for her vision and her dedication in improving the delivery of health care across Ontario. The importance of your leadership cannot be understated, Minister. Change always requires a steady hand at the tiller, and you are showing that in spades, as they say. And let me end by paying tribute to you and your colleagues in government for their tremendous efforts that you all have made to keep Ontarians safe throughout the COVID-19 pandemic. I can only imagine how difficult these past few months have been for you. We have a ways to go yet, but if we continue to work together, we will all get through it. And at this time, it's my pleasure to introduce Brander Gill, Director of Business Solutions and Communications, Addictions and Mental Health Services.
Thank you, Warden Phillips. Hello, everyone. I'd like to start off by thanking Minister Elliott for choosing Hastings County as a backdrop for this very important announcement, emphasizing the important role rural Ontario plays in the provision of healthcare services and supports in our province. The transformation of our province's healthcare system has been no easy feat, but today is a momentous day for us here in Hastings and Prince Edward counties as we welcome the news of our local Ontario Health Team. All aspects of healthcare are integral to the success of these Ontario Health Teams, especially community-based agencies that too provide critical supports and services to individuals journeying through our healthcare system. These integral agencies include addictions and mental health services, community health centers, family health teams, peer support services for people with disabilities, other primary care providers, amongst so many others. The Ontario Health Team model in HPE has already proven to be effective. Over the last many months, providers from all across Hastings and Prince Edward counties have been working collaboratively amongst one another to respond to the evolving COVID-19 pandemic. Collaboration among service providers has brought about this very day to be able to move forward and formally establish our local Ontario Health Team so that we can continue working towards ensuring that the individuals we serve and support can be better connected to their health care and travel and transition through the healthcare system from one provider to another with relative ease. Specifically for addictions and mental health services, Ontario Health Teams are a crucial component of the provincial Addictions and Mental Health Roadmap to Wellness, which in itself sets out to build a better connected mental health and addiction system in Ontario. The Addictions and Mental Health Plan that the provincial government has introduced will be further informed by the work of our Ontario Health Teams. Our Ontario Health Team here in Hastings and Prince Edward will assist, support, and collaborate as one team to better integrate services and supports between hospitals, primary care, and community service providers. Be it hospice, palliative care, personal care, adult day programs, client and patient transportation, caregiver support, amongst other community services, we are excited about the future of healthcare in our area. We will work tirelessly to help break down barriers that individuals may experience in their journey through our healthcare system and work even closer together with one another to better serve and support patients and clients within Hastings and Prince Edward counties. Thank you.
Thank you, Verinder. In addition to the range of organizations who are officially members of the Hastings and Prince Edward, we know there are others who are working along beside us to continue to build a strong web of services in our communities. One of the things that is so important to us as an Ontario Health Team is to recognize the strengths we have, the histories of collaboration and of innovation. Our job now is to build on that, to enable an even stronger web, a more integrated system, and a healthier community. Thank you, Minister Elliott, Minister Smith, for your support. And we also would like to thank MPP Cramp. And thank you to all of the members of the Ontario Health Team for your and our hard work and leadership. Today is a very good day to step forward. Thank you.
We'll now take questions from media. If you have a question, please line up behind me in a single file line. Please stay 6 feet apart. And just a reminder, it's one question, one follow-up. And please say your name and which outlet you're with. Thank you.
Yeah, hi, good afternoon, Deputy Premier. Jamie with the Pool Camera, City TV also. Alberta. They're going through a rough patch, and I know originally when we asked them for help during the first 3 waves, we were denied. But are we going to be helping out Alberta in their time of crisis as they are now?
Yes, we are. Yes, we are. This is a truly cross-Canadian effort. There was a time when Ontario needed some help as well, and other provinces helped us. We will certainly do the same to help Alberta, and our officials are having conversations right now about exactly what they need, and we will be there to support them and help them.
What would that look like?
It may be help in intensive care. Frankly, I think that their intensive care units are very full right now. There may be other requirements that they have as well, but I would expect intensive care assistance would be top of the list.
Okay, thank you for that question. The next question is going to be, Deputy Premier, in default, I'm asking you this question. Where has Premier Ford been?
Premier Ford has been around. Premier Ford is working every day to try and help limit the effects of COVID-19, trying to convince people to please go and get their vaccinations. That's going to be the most important thing. We have a goal to reach 90% of first and second vaccinations as soon as possible. That's what Premier Ford is working on. And he's also working right now on trying to revive our economy, getting people back to work, bringing businesses to Ontario. So Premier Ford is very busy and very active.
Good afternoon, everyone. Deputy Premier, Minister Smith, and all our local dignitaries. I'm Luke Hendry from the Intelligencer and the Post Media papers in the region. Deputy Premier, some of the residents may not really understand what an Ontario Health team looks like, what it means to them. So if I'm entering the system at some point, or if I'm already in it, or I'm a family member of a patient, in what tangible ways will I see changes through this? We understand the integration, maybe easier paths through the system, but what else will they see, and when? How soon?
Well, I think there's two things I could say to that. First, in terms of the big picture, when groups work together as part of an Ontario Health team, they know where the gaps in service are, and they know how to fix them, and they're working together to make sure that it's a complete system for people, so that people never feel that they're being left out of their healthcare system. And that often happens, for example, when people have been in hospital, they're discharged from hospital and they need home care. It doesn't always happen in a timely manner, and sometimes people end up back in hospital before they've ever received home care. With the local Ontario Health teams, before people leave the hospital, they will know who the healthcare provider is that will be coming to them, how often, and at what time of day. So that's one of the things that we've heard from people time after time, is they want to have their health system connected. That's probably the best example I can give you, is making sure that people know what to expect every step along their healthcare journey.
Thank you. And as far as the input of these health teams, how much influence or power, for lack of a better word, do they have in influencing what the government does? Because we know some decisions may be here, but the funding still has to come down from Queen's Park. So how much pull will they have in seeing what happens here?
Well, once the teams are fully established, they will be, there's an agreement between them, of course, and the Ontario government with respect to the budget. They will then receive the budget for their area, and then they will be responsible for making the decisions about what care goes where, and to make sure that they can fill in those gaps, to make sure that service can be covered across the entire geographic area. So they will have a lot of influence. They've told us since the beginning of me taking on this job that we know what to do. Just let us get out of the way, Queen's Park, and let us do our job. And that's exactly what the idea behind Ontario Health Teams is to let the local healthcare providers who know their area better than anyone at Queen's Park could know, to make the decisions about their own local healthcare decisions.
How soon can we see these changes take effect, and what does that look like for everyday people?
Well, I think in many cases, even before the teams have been formally announced, they're informally already working together. So they will get some money further down the line. There will be over $1 million for each local team to help them put things into effect. But many of them are already doing that anyway, because they know that they need to work together to provide that integrated care to patients and families. So you'll already see it on the ground in probably 99% of the Ontario Health teams that have already been set up.
And I think that concludes the media proportion of today's announcement, and we will now do a photo op.